I've got it started. Take it away.
Okay, so my topic obviously is idiopathic vestibular disease, particularly in canines.
Now, can you go back? Sorry. Are you going to tell us what idiopathic means?
I am. Would you
Excellent.
like me to tell you now?
No, go.
Okay. So initially I became interested when this was actually my dog. And you can kind of hear in the background, my mom's calling him, but he's clearly not coming.
Yeah.
And then he's starting to circle, and he's got a head tilt, and he appears to be kind of like disoriented and dizzy.
This is beautiful. See, this is better than I can do.
Yeah, so I was actually really proud of her for taking the video and sending it to me because it made it a whole lot easier to know what she was talking about. Okay, so he's a 12-year-old Yorkie, as you can tell. And like I just mentioned, he was circling, he had a head tilt, he was disoriented, and then when she took him outside to go to the bathroom, he wasn't urinating either. So she initially started to panic and think that he had had like a stroke or he had fallen and hurt his neck or like some serious injury. But since he wasn't experiencing any loss of vision or hearing or consciousness, he wasn't drooling at all, and he didn't seem confused, and he clearly wasn't paralyzed. We ruled out a stroke pretty quickly. And so then our second differential was that it was vestibular disease. And after talking with the vet...
Don't change yet. Okay, I want to add something.
Yeah.
This is beautiful. So notice I brought an extra pointer along in case that one gave out. But now I'll use it. Differential diagnosis. That's what she's talking about. Because that's the forte of any professional. It doesn't take much to prescribe medicine. That's kind of like easy. You look in the book and the doses and the pharmacist will help you. But it's a differential diagnosis. You're faced with something and you got to rule things out, keep things included until, finally you get down to one. I bet you everybody in this room has experienced some professional out there that didn't diagnose something right in you. How many have ever done that? Look at this, half the class. Yeah, and that's the thing. The forte is the differential diagnosis. And I'll tell you what, some people are the professionals and are not very good about it. For one example, somebody in Wisconsin I knew had Lyme disease, but it took 4 years to diagnose it. She was diagnosed with depression and just amazing how many things, and then finally it was diagnosed as Lyme disease. Where if she would have maybe went to a good person at the beginning, it would have been diagnosed as Lyme disease. But she was being treated for depression. And Lyme disease is incredible. Take it away, partner.
Okay. The eventual diagnosis was idiopathic vestibular disease. It's also called old dog disease, so that also upset my mom, knowing that he's now considered an old dog.
And how old was he? Was he 12?
12,
Okay.
yeah. Or he's 12 now, I think he was like 11 when it started.
Close.
So vestibular disease, the overall definition is that it's a sudden, non-progressive disturbance of balance. And it can be kind of similar to vertigo in humans if you've ever experienced that or have someone who's experienced that. And then there are 3 different kinds. We've got the idiopathic, which is the one that I mostly focused on because it's my dog. And that has no known cause, as the word suggests.
Okay, let me add on to that. Yeah, whenever you see idiopathic, that means rising from within, but we don't know. It's coming from within, but we don't know what's going on. Maybe somebody sooner or later will find out, but if you at a loss for words to say, oh, it's idiopathic. It's coming from within. Okay, go ahead.
And then the other 2 forms are the central, which is stemming from an issue in the brain, and the peripheral, where the issue is in the inner ear or somewhere else surrounding the brain. So the different causes, as we just mentioned with idiopathic, there's not a known cause for that one. But for peripheral, the issue is usually something like an inner ear infection or sometimes even like a neck injury. And then with the central form, you tend to have the more serious issues like a brain trauma or tumor. You can have some systemic infections or tick-borne disease like Rocky Mountain spotted fever. Toxoplasmosis and fungal infections can also cause it. Yeah.
So, did you take them to the vet and then have him do a CAT scan or check the brain?
It depends. Sometimes they can kind of rule those things out in a little bit different way. A lot of times they can just do blood work and stuff and kind of see if there's a tumor or bleeding somewhere, and that'll help rule it out as well.
Yeah, because when you have an older dog too, there's always this trade-off about, will I be able to expand the life at all, or do I be conservative and make it comfortable? Cost ends up And then sometimes a vet clinic might have a certain piece of equipment, other times they don't.
Right.
It's amazing. It's a very complex thing, but good question.
Okay, so the symptoms for all 3 different kinds, usually they'll be ataxic, which means they like lack coordination. They'll have a loss of balance. They'll be disoriented. They tend to have a head tilt to the same side as where the issue is stemming from. So if like their ear infection's on their left side, they'll tilt to the left side. And then they can also be circling, so they'll do that to the same side as well. Nystagmus, which is like the eye twitching that I'll show in that video in a second. And then they'll usually be reluctant to stand or walk, like you kind of saw in the video of my dog, just because of that dizziness and disorientation. And then they can be nauseous or vomiting, which is usually caused by like that continuous dizziness. Yeah. So here is a dog with peripheral nystagmus, because his eyes, as you can kind of see, are twitching horizontally. So that usually indicates that it's the peripheral form of the disease.
That's an excellent demo of that.
Mm-hmm. Okay, so central vestibular disease, it's obviously the most serious form because of the issues in the brain. And these dogs will usually have abnormal behavior and awareness of their surroundings. But the symptoms will often be less extreme than with the peripheral or idiopathic form because the cause develops over a more extended period of time. So like with a brain tumor or brain bleed, like it's not quite as sudden. And so they'll have more time to kind of cope with their difficulties and get their like understanding, I guess. They can have defects with their conscious proprioception. So if you flip their paw over, they won't recognize that their foot is misplaced and they won't automatically adjust it. And then these dogs with central vestibular disease will have vertical nystagmus. So like you can see in this video, his eye will be twitching up and down rather than left to right.
Wow.
So this is a dog with a brain tumor. So that spot where the arrow is, as you can see right here, he has the central vestibular disease. Peripheral vestibular disease, like I mentioned before, is located in the inner ear. So it will be like right around here that they'll have an ear infection. And their behavior and awareness will be normal and their CPs will be normal. And then the nystagmus, as you saw in that first video, will be either horizontal or rotational. And their onset will typically be acute, so they'll kind of suddenly just have these like really weird symptoms and you won't know where it came from. And this dog, as you can see in the scan where it's circled, he has kind of that wider area right here, and that's an ear infection that he's got going on. So idiopathic vestibular disease, like we mentioned before, has an unknown cause, but it's actually the most common form of the disease. And like the peripheral form, the onset will be acute, so you'll have really sudden signs with severe forms in the first day or two, and then within about a week to 2 weeks, they'll usually have most of the symptoms gone. So the treatment, obviously it depends what kind of disease that they have. If it's caused by an ear infection, usually an anti-inflammatory will get rid of most of it. But if it's a more serious form, like a brain tumor or something, obviously you'll probably need to do surgery. With idiopathic form, usually it'll resolve on its own without any kind of treatment unless they're like really nauseous and vomiting a lot, in which case you'll usually give an anti-nausea medicine. And sometimes they'll have that head tilt kind of permanently afterwards, and a lot of them will have repeat episodes down the line. So our dog usually has it like once a month. He'll just have kind of a rough day where he's circling a lot and just kind of wants to sleep.
I was going to ask you about your dog.
Yeah.
So.
And then just the overall care when they're having an episode. And it's important to help them like stay quiet and get rested. So just give them a nice space to kind of lay down and chill out. You're going to keep them from climbing on stairs and furniture, obviously, because when they're dizzy, they're more likely to fall and hurt themselves. And then you want to keep track of how much food and water they're eating, because a lot of them, when they're feeling nauseous or dizzy, they're not going to want to eat or drink as much. And then you want to keep from picking them up, because I know sometimes with our dog, my mom wanted to pick him up and put him on the bed or something so he was more comfortable, but it's actually important that they have that like sensors, I guess, on their feet to kind of get a little bit of an idea of where their placement is. Otherwise, when you pick them up, they're like even more thrown off than just as they would be on their own. And it can also help to switch from a collar to a harness. So for dogs that get it caused by neck injuries, it can help to kind of displace that pulling when you're taking them for walks and stuff. And there's our dog today. That's not actually like a real head tilt. That's just him when you talk to him. But he's feeling better. He gets an episode, like I said, like once a month. But he's doing pretty good.
You
Any
ready
questions?
for some questions?
Yeah.
So when you were describing the symptoms for the, I believe it was the peripheral, you said like they would have the head tilt or the circling, and it would be in the direction according to like which side the ear infection was on. So if you had immediately started thinking that it could have been this, how would you have known that it was idiopathic versus peripheral? Like, did he go both ways? Did he circle both ways?
Yeah, a lot of times it could be idiopathic and peripheral, if that makes sense. So it'll be like something outside of the brain, but you can't really specifically say exactly what's causing it. So they can't say like, oh, it's an inner ear infection if it's not, but it's something outside of the brain.
So if it's idiopathic, you said it can clear up, but if it's something like you don't know the cause of, it's obviously like not the brain or something. Is this something that usually lasts the rest of their life, or?
The idiopathic, usually they will have more episodes down the line. So I guess yes.
Yeah.
But sometimes they can have like the one episode and
And
never
then it clears up.
have anything again, yeah.
Okay.
Yeah, and then they could have central and have one episode and then it might clear up, you never know. Because, you know, it's amazing how the body accommodates sometimes. I mean, that's kind of what you're saying. They have an episode, but then it might, you know, a lot of times your slide said in 2 weeks they're recovered.
Right.
Now, did you have any actual meds given to your dog?
We didn't. He wasn't vomiting.
Okay.
So we just kind of let him relax.
So then, so you took him to a vet, they diagnosed the idiopathic and said, we'll see what happens, about once a month an episode. Okay. Yeah, it's amazing how varied all this stuff can be. Some things can pop up, that would be clinical, and then if they're not popped up, it's really subclinical. And it could have been 2 years of subclinical, and then something just happened, boom.
Right.
It's amazing. That's why, and this is fine. You know, there's a thought out in the real world, for humans at least, that everybody that dies should have an autopsy. And you know why? There's a thing about that. Because some people die of like a car accident, but they had a tumor growing in their brain and they would have died maybe 2 years from now. And you get a better idea of the general health of the population. You know, because, you know, there's all these things about clusters of tumors and all that, and if somebody dies before they're discovered, it might impede you finding a focus of some kind of cancer or something like Flint, Michigan, and the lead, you know, all that kind of stuff. So it's really, in animals it would be good too, but we do even less. So now, like idiopathic for your dog, refresh my memory, did they do any x-rays or imaging?
I don't think they did.
Okay, yeah. So that's the other thing. It could be central. Your dog could have central, but it's not discovered,
Right.
so then you say idiopathic. See what I mean? But if a necropsy was done maybe when it dies, because you don't say autopsy for animals, you say necropsy, right? So when your dog dies, hopefully it lives forever, but anyway, I mean that actually, but if you had a necropsy, then you could have more of a definite diagnosis. But, you know, most of us wouldn't, you know, do that, but.
Yeah.
It's just something controversial out there in the real world, because some people say everybody should have an autopsy, because just to get the idea of what's going on in that body. Because if somebody dies of a car accident and they get buried or cremated, maybe there was something else going on. You know what I mean? So, yeah. Other questions? Here we go.
Is it like breed specific? So I know that you have like a Lab, a German Shepherd, Yorkie. So is it kind of affects any breed? Really?
So you're asking, is there certain breeds that have
Like
this more common?
Yeah.
Yeah, from what I read, it was actually more common in large breeds, but no like specific breeds from what they said.
And that's a whole good, maybe on Wednesday I'll show you a website I've got. You can click on a breed and it tells you the genetic predispositions it has, like diseases, things like that. It's great to know, because yeah, it's a good question, because some breeds have more X than other breeds.